Welcome to this episode of ECGs Made Simple. Now, if you're just stumbling across this video, make sure you subscribe and check out the other episodes. With that out of the way, let's get started. So now we have everything we need to know to identify a rhythm, or the 5 questions that you ask. We know how to get the rate, we know how to figure out the regularity, we know that the P waves is electricity beginning in the SA node and traveling through the atria, and we know that that's that first wave in the cardiac cycle. We know how to measure the QRS complex and the PRI. So let's take a look at how rhythms are classified, and then we're going to use these 5 questions to identify every single rhythm that the heart can generate. So what's up with the EKG names? Well, they're not arbitrary. There's a rhyme and a reason, and we're not going to go over every name, but I'm going to show you how to break down the names of each EKG rhythm, the origin of the impulse, and a rate. Now, when I say rate, it's not the exact heart rate, and this doesn't apply to every single rhythm, but about 90% of the rhythms will give you a heart rate range. And if you combine that heart rate range with the origin of the impulse, you get the rhythm. For example, the things that start here are sinus or atrial rhythms. Impulses that start here are junctional. Blocks are a conduction problem, but we're going to cover that in the next video. And then anything that starts down here is considered ventricular. Now, this is how the series is going to be organized. We're going to go over all the sinus and atrial rhythms today. The next video is going to be blocks and junctional, and the video after that will be ventricular rhythms. Let me give you an example of what I'm talking about. Let's say that we have an impulse that initiates in the sinus node. Well, the origin of the impulse is sinus. Now, let's say that the rate is 80. The names are based off of the rate name, and the rate is 80, and normal is 60 to 100. So that is normal. The rhythm is normal sinus rhythm. It's saying it initiated in the sinus and the rate is normal. You want to try some more? All right, let's try some more. Here we go. Origin, rate, and rhythm. All right, so for our first example, we have a impulse initiating in the sinus node. We have a rate between 60 and 100. We just went over this one. What's the rhythm? You're right, normal sinus rhythm. Okay, well, let's try another one. Another impulse that starts in the sinus node. The rate is greater than 100. So what's the name for a heart rate greater than 100? Tachycardia. So what's the name of the rhythm? You got it, sinus tach. Now I'm going to pause on this next one because I want you to try to do it yourself. We have another impulse originating in the sinus node. This time the rate is less than 60. Go ahead. You got it. Sinus bradycardia. Now let's go back to EKGs and see what these look like on the cardiac monitor. And that's it for this episode of ECGs Made Easy. Now to catch our other episodes, go ahead and click right here, and I'll see you over there.